Thank you so much, Reg. So I've been given a few minutes just to talk briefly about what we do, and then I know we're going to segue into a larger discussion, and I want to make sure that I don't monopolize the time. But this project that we just modeled for you is from a project called End of Life. We performed it at the Mayo Clinic, in nursing facilities, on town squares in New England, where 200 octogenarians came out one night with their own lawn chairs to hear Greek tragedy and talk about death on their own volition. And, you know, the project was born as a labor of love. As I mentioned before, I lost my girlfriend in 2003. Then a few years later, lost my father after he had a transplant as well, and spent much of my 20s as a caregiver. And all of a sudden, the plays that I had translated, that I studied in Greek and in Latin, that seemed sort of powerful but not directly connected to my life, spoke to me with an efficacy and a directness that I never could have imagined had I not come into contact with death and suffering. And then I realized that if I put plays like this in front of people who had lived the experience of the plays, people who had been in contact with death, that it would unlock something in the audience. It would give the audience permission to talk about things that are hard to talk about. And so that's what End of Life is about. At one of the first performances at Harvard Medical School, an oncologist stood up in the back and he said, trembling and crying after hearing several of these scenes, "I've never in all of my years, 35 years of practicing medicine, questioned my views on euthanasia until hearing Rock Dutton, the actor that night, screaming as Heracles in the other play that we performed, begging to be killed by his son." And then later, in a different performance, we always know, as I mentioned before, talking about medical hierarchies, I always know that a project is working when the lowest-ranking member of the community gets up and speaks in front of the highest-ranking member of the community. Then you know that the theater has done its work. It's sort of destabilized the hierarchy. It's empowered people who know something truthful to speak it. And this man approached the microphone, and he had long white hair and a jean jacket and jeans, and he was shaking, and he said into the microphone in front of these, this audience of doctors that included, I think, the dean of Harvard Medical School, "Forgive me, I've never spoken before in public in my entire life, but I feel compelled to speak tonight. I just want to apologize to all of the doctors in the audience," he said, "because you don't get to be with your patients when they die." He says, I don't, this is me paraphrasing him at this point, he did say a direct quote just now. He said, he's not fetishizing it, it's not something that he's, trying to, make it sound like it's all wine and roses. He said, I witness terrible things, but I also witness miracles every day. And I just feel so sorry for you, because of our medical system, to be marginalized from this incredible moment, to be separated. So, as we've traveled the country and done it for children's hospitals, public squares, in medical schools, and now a portion here, our objective is to create the conditions for open dialogue, to help people speak the unspeakable, to give voice and vocabulary to their experiences. Now, one final caveat, the academic part. This is no coincidence. This play was written in the 5th century BC at the very moment where medicine was being formalized as a practice, this very sign right here, this snake of Asclepius, the god of healing. This 5th century, at the same time, the Hippocratic Oath is being written. These plays are being performed. If we believe Thucydides, 30% of the population of Athens, 15 years before this play was performed, was wiped out by a plague that we now believe to be typhoid fever. This is a population that out of 100 years saw nearly 80 years of war. There wouldn't have been anyone in that outdoor amphitheater at the center of that democracy from whom we receive so many things thousands of years later and emulate in so many ways that wouldn't have known the screams of Philoctetes, wouldn't have known the conflicts of a caregiver who had an agenda and then had to make an ethical decision about what to do when faced with someone else's pain. And so I would put out there that this was the original mass media public health intervention around end-of-life care. And that's why it works today in the audiences for whom we perform. That's why, like an external hard drive, when you plug it into the audience, it knows what to do, and the audience knows what to do back. It's an ancient technology that's the predecessor of the clips that we saw here tonight, but all the more powerful now that we've lost touch with the opportunity that theater provides for us to come into a room together and have a shared response, even if it's not the same response to suffering. And I'll leave us with that, and I'll turn things back over to Dr. Baer.